I'd like to welcome everyone to our Acne Awareness webinar. We are so excited to be able to present this topic with you. My name is Tiffany McLaughlin, and I am one of the executive education team members. And I am here with Ella Cressman, also an educational team member today, to share with you some of our thoughts, theories, and recommendations on acne. How's it
Hi,
going, Ella?
everyone. I am so excited. This is one of my favorite topics to discuss because it is actually, as a practitioner, it's something that we get to hone in on. But it's a condition or it's an ailment that keeps us on our toes. So it's very interesting.
Absolutely. We know that over 50 million people are affected by acne. So, as our environment continually changes, especially within the last 18 months for sure, with that, our skincare has to adapt, just like our lifestyles, where we live, what's going on in our lives with our stress levels. All of these things can initiate acne aggressors. So, we need to know and make sure we are aware of how to manage, treat, both in clinic as well as professionally guided home treatments and home maintenance to achieve that clear complexion for optimal skin health. So, once we start to look at things, starting from the basics that we learn in school, that primary acne theory. Now, depending upon where you actually went to school, will probably determine the amount or the depth of knowledge that you actually receive about acne. Now, some of the specifics that almost are always covered are initially those topical triggers. So, what are you putting on your face? Is it your makeup? Is it your skincare products? Maybe you're not putting anything on your face, and this is what's causing your acne. So, with that, as they go through that, they also can address the immune function. The Langerhans cell, is it being deactivated because you're not using proper sun protection, and specifics with that, as well as diet and genetics. We know that acne is a genetic disease of the follicle that can be treated and properly managed, but unfortunately not cured. So, with that, if your mother and your father and your sister have had to struggle with acne, more than likely there might be a problem within your genes as well. With that, we can also combine diet. Is it in the french fries? Is it the grease? Or is it the salt, right? So these are some of those primary acne theories that we talk about initially. But once we get out into the actual field, it's kind of a different story.
Yes, actually, again, acne is one of my favorite things to understand. But when I got out of school, I had that primary education on acne. And as I am seeing clients and doing complete consultations, several times with different people and finding that not everything was that I learned was applying. So, additionally, what I've understood as a skilled practitioner that there is a difference in hormonal acne differentiation. This goes beyond, I'm on my period, I got a pimple. There are other hormones that actually affect acne. Also, adrenal, acne, and stress. So we know I'm stressed out, I got a pimple, but what does it really mean? Especially as Tiffany mentioned, in the last 18 months, we've seen the
Absolutely.
rise in adrenal acne. And what does that mean? So something as part of my consultation is really seeing a lot more of that. So that's where the lifestyle comes into play. And then another one of my favorite catch-all terms is idiopathic acne, which is basically throwing your hands up and going, I don't know. So it often starts out there because you go through the things, you learn this in school, you learn this from your product reps, you learn these things, and it's not fitting into a box. So what I learned in actual experience, hands on, after school was way more valuable. I learned it from working on clients. I learned it from understanding from my peers, asking them, this isn't working the way I learned it. What is going on? And especially from my product reps at the time, my educators, and then putting it all together and voila, here we go. One of the first, I guess we can sum it up into 4 main acne aggressor categories. And the first is going to be lipid content and composition changes. So when we hear acne, we think overproduction of oil, but actually it's not always the case. So not just the content, but what is it made of? Is it sludgy? Is it Is it streamy? So those are things to consider. And then we have dead skin cell buildup. This is another contributor or an aggressor, and we'll talk deeply about that. And the other one is hormones. And so there is an influence beyond just ovulation or female hormones. What are the other hormones that affect? And then the last one would be inflammation, which is something that I feel in the last 10 years we've definitely had a greater understanding of, but we're going to explore that today.
Seeing how, at least, being in the industry over 20 plus years, that inflammation it's just amazing how we are discovering more and more how much it truly does have an effect on the skin and the skin's health.
Absolutely.
When we look at the two primary different types of acne or acne conditions that we have, the first one is going to be oily acne. And when we see this is obviously that overproduction of oil, where that follicle is going to fill up initially with oil and there's just too much. It's too much for it to handle. And then that's where, once we can initiate that closed comedone, but then it can grow into an inflammatory lesion. Primary with our oily acne, skin needs that hydration and balance. The oil is going gangbusters because it's trying to overcompensate for something. And with that, we need to remember and look into the fact that when we see that oily acne, a lot of the times it will say, you look at it and you say, oh my gosh, the top of their face is just an oil slick. The surface, you can see it, you can feel it, you can feel that oil. However, once you get past that topical oiliness, you notice below on that actual skin's surface that the skin is actually quite dry. It doesn't have the ability to produce or maintain that barrier function. And so that oil is overproducing to try to compensate for that, as well as the fact that there isn't enough hydration in the skin. And so once again, it is trying to overproduce. If we have one of those sebaceous glands that just continues and continues and continues to produce oil, this is where we really need to get down and dirty, look into some internal issues with the client, as well as saying, okay, we need to address more than just that topical oil. Now we have our dry acne. With our dry acne, a lot of the times, and where I live in the Mountain West, where Ella lives in Colorado, I live in Utah, I actually see a lot of dry acne.
Same. And that was interesting for me when I first started working on clients, is like, wait, this is not fitting in here. So dry acne is one of my favorite things.
Yes, definitely. So this is where a lot of the times you want to consider the climate of where you live. Do you live in a more humid climate, dry climate, higher elevation? All of those things are going to be definitely taken into consideration with that dry acne. Where do they live? Have they moved there? What is their lifestyle? Is it high stress? Is it low stress? Where I live, there are two very large universities. So a lot of the times, obviously, the students are going to come from out of state and come here, but they are not used to the dry, high elevation, that dry climate. And with a life changing, going to college, high stress, all of those things, they break out. And so with that, and the problem is it's that change that they don't have enough hydration in the skin. And that's where we really see a lot of dry acne. This is where you can find very compacted sebum into those follicles. And with that, it increases that filament. So it just almost becomes very, very hard and very difficult with large open comedones, where you see the really large blackheads on the skin. But once you try to extract them, they don't want to come out. They're just stuck right there at the top, right at that ostium, that the opening of the follicle. That's where we really need to soften it up. Once again, get a little bit more hydration into the skin to get them out.
I have that. These are sludgy. I have classifications with my client where I use plain language when during consultation or in describing. And these what I would describe as the grain of rice. So when it does finally come out, it squeaks out. It looks like a grain of rice. And there's your indication that this could be dry acne because it's that slowed. The sebum is like, I think I can, I think I can, I think I can. I just need to get out there. I just need to get out there for the barrier function. But then, nope. So that is those little grains of rice are now what I'm getting a lot more now. I'm seeing they look like bowling pins when they come
Yes.
out. They're
Yes.
like they almost have a stripe on them too because of the oxidation.
Yes.
But their grains of rice are bowling pins versus like inflammatory acne, which would be the mirror squirters or the snakes.
Well, and at least for me, I've found utilizing the Mystique illuminating polisher and combining it with the ice refining mask is an amazing disincrustation solution that
Mm-hmm.
really helps to soften those up and just help with that extraction
Then they
process
go
too.
plink plink instead of.
Yep. You know, give it a little bit of grease, so to speak.
One of the okay, so when we were able to open back up and start seeing clients again, this is something that we've been dealing with. This has been about a year for myself here in Colorado. It's maskne. This is crazy how this took off. And initially, part of the understanding of what is maskne, what causes maskne, was thinking about maybe it's stress, maybe it's my breath that's causing. But the truth is, what my deduction is, it's those cotton or paper masks that actually interfere with the lipid content. And by this, I mean our barrier function. So there is a disruption of that. And so then there's either an overproduction or an underproduction, therefore, and then we have inflammation. And then that inflammation causes those, is a vicious cycle of interfollicular epidermal hyperproliferation. But basically, it's just continuing on. So we have these little sebaceous filaments. They can't get out. And then they're just about as angry and fed up with the last 18 months as we are. And then here we go. So not only am I wearing this and suffocating, but now I'm getting acne. Ah! But I found that myself, I started wearing a different material. And then it changed for myself in particular, which was awful. Here I am, an esthetician that has these, and they're painful. They're
Yes.
painful. It's not just like, it's not just a bowling pin. It's not just a grain of rice. These are like in hiding. They're like groundhogs. They're like way underneath, but causing a lot of havoc. And so wearing a different kind of fabric, I wear silk. It was a game changer. And so I also have advised my clients to do the same because then at least it's not a lipid interference that we're having to deal with. We're just dealing with the inflammation at that point and encouraging exfoliation.
So when we see that wonderful and really awesome word that's kind of fun to say, that interfollicular epidermal hyperproliferation, you can see here that we have got to clean out the follicle. And one of the things that we want to remember with that fact is that we do have those dead skin layers on our stratum corneum, right? We have 20 to 30 dead layers up there, but also keeping in mind that we do have those 7 to 10 dead layers lining that follicular wall. And that's where a lot of the times that we want to remember is that those dead skin cells in that hair follicle are the ones that basically want to stay there and party. I always like to, when I was teaching school, I always like to kind of give this story about having a big fraternity party in your hair follicle, and those dead skin cells, man, they never want to leave. They just want to stay there and hang out and have fun, and they don't want to leave. And with that, that's where it causes that havoc. And you can see with this illustration there where you continually have that sebum feeding into, or as we like to say, those backdoor neighbors that always want, hey, oh, party, yeah, I'm coming. And they come through the back door, but they don't never leave. Once again, never leave. And so that's where that buildup becomes a problem. When we have that buildup of dead skin cells, we mix it with the sebum. That's where we will initiate that microcomadone or that clog within the actual follicle. And if it cannot be resolved, that's when that inflammation starts to happen.
And then mirror squirter.
Yes, the mirror. But yet it's so gratifying,
I
even when you have to
know.
wipe it off.
Oh, you're like, you kind of want to look and see all the sebum and skin cells.
Absolutely. But with that, we always want to make sure that in order to achieve this, we need to have exfoliation. Exfoliation is going to be essential in both our in-clinic as well as our home management programs. And so with that, we need to make sure that we are achieving that with our clients and making sure that they understand. Educating that client is so very important. So when we talk about exfoliation and we start with that exfoliation process, you can see here, this is one of Lira Clinical's hybrid treatments. It's our Vibrant Clarity. And with that, we have combined our Sal Pulp, which works beautifully for acne, but we've also combined it with the Biohydra C Serum. So this is a wonderful first-time treatment or maintaining treatment with a client that is starting to experience that acne. With the Vibrant Clarity, the combination of the Biohydra C that has not only vitamin C, but also topical probiotics and our wonderful exclusive Mastec, it combines it with that cell that works very, very nicely, once again, as giving us that disincrustation just a little bit. So we have the ability to extract as needed. Very common treatments that are recommended by our skincare professionals. You can see here, obviously we know that Lira Clinical does have a full spectrum of all of your peeling solutions from enzymes all the way up to TCA. So with that, what is your favorite? What works best for you, customizing to your clients, their lifestyle, where you live, and what
Their
type
GPS.
of acne? Absolutely. We want to make sure that we are guiding them to the right path and the right system for success. Exfoliation is also a very standard medical prescription protocol. If they are going to a dermatologist, what are they going to recommend for them? Almost always retinol, maybe an antibiotic, a topical or internal antibiotic. A lot of those are very common prescriptions that will be suggested. But one of the things that we definitely want to make sure that we are careful with our acne skin is overexfoliation. So this can be your chronic retinoic acid users. And with that keyword retinoic acid, we're not using retinol, we're not using retinol palmitate, but we're using retinoic acid that can be a lot more irritating to the skin. It can be effective, but it can cause that topical irritation and redness to the skin as well.
And blackheads. This is one interesting thing, that this overexfoliation, so you are trying to fight against acne, but you're overexfoliating, leaving you're messing with the natural order if you're doing it too much.
Yes.
And then all of a sudden you've got these oxidized sebaceous filaments because there hasn't been enough time for the sebum to excrete and become barrier function, right? And so that I've seen it where people are like, I don't know, I'm using this and I'm using more tretinoin, or more, prescription retin-A, and I've just keep getting these blackheads. Well, let's back off of that a little bit, and wouldn't you know, voila, problem solved. So it is a balance, not too much, the Goldilocks, not too little, not too much, just right.
We need it just right.
And then another culprit is hormones. But as we mentioned before, our poor periods, they take so much blame for everything. At least mine do. I'm like, blame it on my period. But there is hormonal differentiation. Not all hormonal acne is reproductively related, and it's not all affecting females. What we've got is sex hormones, of course, that can imbalance both men and women, but that's not where the story ends. Natural and synthetic hormones affect skin conditions too. So this is going to be from birth control. This is going to be from food that you consume.
Absolutely.
Or from also, I have a client who is a professional bodybuilder, and in his bulking period, he has some assistance, and that it affects his shoulders, his back, his face, everything. But also I have professional bodybuilder clients who are just doing it the natural way, but when they're done with competition, then there's an adjustment. Those are those natural and synthetic hormones. But it's not always male hormones. There's other factors. There
Absolutely.
are hormonal changes. So the first hormonal change that we again point at is ovulation, and when we do that, we think of menstrual cycle breakouts, pregnancy, and breastfeeding, and that is true, and that is a real thing. But we also have puberty, menopause, and even PCOS. These are affected by, as we said before, both birth control and steroids. Then again, we've seen with our lifestyle something called adrenal acne. That is when your adrenal activity changes, and that is stress induced. So we've heard that before, but really what it means is it's kicking all of the hormones out of balance. And we also have with food.
Yes.
With food,
Yeah,
go ahead, Tiffany.
I was just going to say with your adrenal acne, that's where the hormone of your cortisol, where it really will spike. And that's where you can see a lot of the times those really large, painful, inflamed acne lesions that all of a sudden it feels like they almost came overnight because of that surge of cortisol. And it is a predominantly male hormone. That's where a lot of the times that will happen as well.
So to piggyback on Tiffany's frat house analogy, this is what I explain to my clients often too. It's almost like you have a sebaceous filament just hanging out, just like, I know I'm not exactly the way I'm supposed to be, but I'm just going to hang out here for a little bit. Normally, you might come along and post shower, do your own extraction, and it'd be very easy breezy. But when you have adrenal hormones or cortisol hormones released at a time of stress or a time of vulnerability, it's like I always say, and no, please, I don't want to offend anybody if you're a frat brother. I'm so sorry, but here's my analogy. It's like a bunch of frat guys coming along to beat it up, like to kick it. Oh yeah, you don't belong here. We're gonna kick you out. But in doing so, instead of just like nicely escorting sebaceous filament out, they have caused all this inflammation around, which makes it impossible for said filament to release in the first place. So that is those painful, they call them the underground pimples, those really hard ones that they're so unsatisfactory because you can't get anything out of it because the tissue is so inflamed around it. So something to consider. Frat boy acne.
Yeah, but I'm sure everyone's thinking, and whether or not you went to college, that's a total choice. But yeah, even then, I mean, I can tell you, I have a teenage boy and one that's almost a teenager, and come on, I'm sure everyone can relate with at least, they're sitting there in the living room playing video games, and you're like, go outside, stop just hanging out. You need to go outside, do something, those types of things. And that's where, unfortunately, that's what they're doing in your follicle. You just, come on, just get out, leave.
Move it out.
I need to have some space.
Right. Totally. And then we got one more, that's okay. One of my all-time favorite words, again, is idiopathic, which means I don't have any idea. And there is actually a condition, idiopathic acne, which was what back in the early 80s they diagnosed when it was PCOS related, because they really didn't have an understanding of PCOS and that effect. But they're like, they're breaking out, not quite sure if it's adrenal or ovarian, but it's acne, it's idiopathic acne. But what they found recently is a connection with Hirschism, which is unexplained hair growth, which is why they were putting this idiopathic acne along with PCOS. But there is this unexpected and unexplained hair growth, not PCOS related, that is related to acne. So it's hormones again.
So once again, blaming it on those hormones.
Absolutely.
With that, we can also look at our inflammation and our immune function. So you can see here a nice, wonderful, beautiful, healthy cell on the left side of your screen that it begins to be attacked by super unfriendly free radicals and gradually that cell is starting to disintegrate. It's starting to lose its shape and lose its health, for lack of a better word, because the free radicals are targeting it and attacking it, triggering that inflammation cascade, because we know that those foreign bodies in our foreign invaders in our bodies are initiating that inflammatory response. We say, hey, this is not supposed to be here. And so our immune function kicks in and is trying to protect us. And with that, depending upon how it is responding to it, that inflammation cascade can go very, very quickly or a little bit slowly. So we want to see and try to determine that free radical absorption and activity that is happening in our skin. The best and easiest way that we have the ability to control that free radical absorption from external factors such as sun exposure, pollutants, all of that is obviously using our broad spectrum SPF. It is so important that we make sure that we are using our sun protection on a daily basis, and we're emphasizing that to our clients. It's not just something for aging skin or pigmented skin, but also for acne as well. And a lot of the times, the inflammation that is coming up and initiating those acne lesions, really there is that co-issue that's happening. Something is going on internally that needs to be addressed. And as an esthetician, we can ask those questions within our client consultation, but a lot of the times that's when it is needed to possibly refer that client to a nutritionist, to a dietitian, to a physician that specializes in that gut health, that there's something going on that needs to be fixed, that needs to be taken care of internally before we can take care of what's going on externally, because there is that direct correlation with gut health influencing skin health.
Absolutely. You can even see it after you've had an upset stomach episode, the changes in your skin.
So with that, we also look towards, when you can see here a before and after. This is a client that had inflammatory acne, borderline grade 3 to grade 4 acne. When we're looking at that, when we target and look at inflammation with our skin, we can look at that trauma. Is that something that a client is initiating on their own? So with that, if you can see, a lot of the times, depending upon the client's lifestyle, maybe recreational medication that they are taking, this is where a lot of the times that self-induced manual manipulation or picking on the skin will also initiate more trauma and more inflammation to the skin, which once again, it is kind of exacerbating or increasing that inflammatory process by itself. Climate, humidity versus an arid climate will also really target with our immune function and inflammation. If you live down south or in warmer areas that has a high humidity content, that's where naturally the skin is going to be a little bit more or easier to have that water retention. And a lot of the times that will initiate that internal inflammation in the skin, versus the opposite with where, for example, where Ella and I both live in the Mountain West, where it's very, very arid, it's very dry, we have a high climate, and there's no humidity. So that's where we see that dry acne with a lot of surface oil, but there's nothing underneath. And that can start to increase that inflammatory process as well. All of these things that we are looking at, we need to remember that our skin is the immune system's response. It's the first line of defense with our bodies, because what happens, all our skin is there, it's in the environment, it's out there, but it also has to make sure that it's keeping everything on the inside protected. And this is where it is so, so very important that we have that microbiome balance within our stratum corneum, within our epidermis, that we keep the good bacteria in there, get rid of the bad, and making sure that we do have that balanced and healthy barrier function. That balance between that oil and water production is so essential in making sure we are achieving results with our acne prone skin. So when someone comes in and they say, fix it, I need to, what can you do? I want to have clearly beautiful skin. This is where Lira can come into play. With a cleanse, correct, restore, and protect. This is your initial and your primary steps that you can use with your actual products to target and customize your actual home maintenance for your clients. You can see here a picture of our Acne Essentials kit that works very, very nicely to start your clients off on a full home care program, or it works great for travel now that everyone's starting to kind of get out of their shell and get out of the house. We are so excited that we can offer those as travel wonderful, TSA approved, of course.
Hope kits.
Yes,
Restoring
that's what
hope.
they should be.
I
With
find
that-
too, sorry.
No, go ahead.
I find that you touched on a key point, and I just wanted to jump in and say it here, is home care. Because when you have clients that are suffering with acne, you know, just like with any Lira clinical protocol, the in-clinic protocol and the home care, that this is a team effort. That
Absolutely.
This isn't just, because I have people who come into my clinic all the time, like, I have acne, can I get a treatment? And I will decline if they're not doing their part at home. And so this is a very easy and easy to implement program, an easy, a 1, 2, 3, 4, no big deal for anyone starting, but this is key to success. You can do extractions in clinic, you can do chemical peels in clinic, you can do everything in clinic, but this is a team effort, and every team member has to pull their weight. And so home care needs to be emphasized as so important. And here we have 4 easy steps, not just easy for the practitioner to refer, but also for the recipient to perform. But it's also explained in a way that I feel that once you explain why they're using these steps this way, that they're more compliant. Would you say, Tiffany?
Absolutely. And that's one nice thing, is that, you're not giving them 6, 7, 8 steps to do in the morning and in the night. I've found, at least from my experience, especially when you're dealing with your younger clientele with adolescent acne, the simpler the better. And that's where, when Lira has our products, they're so versatile and they're doing more than one thing. And so you can have an efficient step-by-step 3, 4, usually at the most 5 steps that client has to do. And that's easy for them. They can remember to do that. And so that's where it seems to be that they are a lot more compliant with it as well.
Mm-hmm.
So when you take into consideration, when we look at Lira overall, keep in mind, because the ice line is not the only line that you can pull from for products when you are dealing with acne and home maintenance, and even within your in-clinic treatments. You can mix and match and customize and personalize that client's home care program to what their skin needs. And that is so very important. With the ice line, it is the primary line. And we do have our exclusive advanced healing peptide delivery system that enables those active agents such as salicylic acid, benzoyl peroxide, resorcinol, all of those things to be non-irritating, but have the ability to get into the skin and work better with those active agents. We also have our topical cultured probiotics. Now we have both cultured as well as fermented probiotics throughout the Lira line. Here in the ice line, it is a cultured probiotic because it does target more of that gram-negative bacteria. And so that's where the healing peptide delivery system with the topical probiotics works so beautifully to help balance out the microbiome and once again allowing those active agents farther down into the skin. And well, it is one of my favorites. I would say maybe it's one of Ella's favorites too. Is our exclusive Mastec. This is really one of the big things that really makes the difference, in my opinion, with the Lira clinical line, and especially within our ice line. So many years trying to treat acne, trying to manage acne, and then people get on the ice line and they come back and they're like, I just see and feel a difference almost immediately because there's no redness to my skin. There's no irritation. It's not all flaky. It looks healthy. And that's one of the things that we can achieve when you combine these three specific ingredients together: healing peptide delivery, the probiotics, and our Mastec. Beautiful pore refinement, not just for acne, but for any skin condition, and the wonderful natural antimicrobial properties that we can find within our Mastec ingredient technology.
Yes, Tiffany, Mastec is my favorite. And here we find it in the beautiful Mystique line. So Mystique and acne, how does that make sense? So remember, we have talked about lipid inconsistencies, and we've also talked about inflammation. And what a better, it's a complement. And it's an efficient complement, as Tiffany pointed out. The Mystique line in particular is incredibly anti-inflammatory. And then it's also the terpenes that are found in the Mystique that rebuild skin function, which is awesome. In addition to, of course, the orange plant stem cells, which I think of orange, I think of bouncy ball, and that's my keyword for elastin. But also, the Mystique Illuminating Beauty Oil is so close to our natural sebum that it helps to mimic natural hydration, which is key in balancing that lipid production.
And this, our illuminating oil, actually, for me, with those dry acne clients, this is a wonderful hydrator. It's really concentrated. It's a dry oil. They only need a few drops, but helping to balance out that natural hydration in the skin really seems to help, especially once again with those clients that have a lot of topical oil. The beauty oil, they're like, I don't want to put oil on my face, and
I know,
like,
it seems so counterintuitive.
Yes, you have to tell them it's okay. It's not going to feel greasy. Have them try it with you so they see how it feels, but it really helps to balance it out.
Yes. It also, with the Mastec, has pore refinement and is antimicrobial, which is perfect for the bacterial acne. The Bio line is another really great line when you're looking at complementary because it helps to restore balance. So often acne is an imbalance. There's an imbalance in function, which creates a domino effect of other misfunction. So the BioLine helps to nourish with plant stem cells. It's great for skin with co-issues like aging acne, pigment acne, and it helps to replenish healing hydration. With the Biohydra Infusion is one great product that is a complement to the others, but also the hydrating mineral mist inside of masks. I had some of my clients here, especially that are still using the cloth masks, the reusable cloth masks. This is so amazing as a turnaround. Let's say they have, a silk aversion for whatever reason. This is a good complement for that, for maskne.
And I found acne rosacea, when those two are combined, our Bio Caviar Cream actually is a wonderful way to help kind of, once again, kind of balance it out, but really help to reduce the redness. And the Biohydra Infusion, just with its lightweight and the colloidal silver and gold in the Hydra Infusion, works beautifully as a lightweight hydrator.
Oh yeah, and we can mention that there's hydration, there's moisture and oil. There's water and oil. There's that water and oil balance in our skin. So the Hydra Infusion is great for that the skin that needs to be quenched, I would say. So it is the key thing. Very
tall
important.
Drink of water for your skin. And then we have our Pro line. So with this, a lot of the times, and back in the day when Lira was actually initially released, we only had the Pro and the Bio line. And we actually found really nice results with using our Pro line. It primary goal with your pro line, we know pro meaning professional, is that exfoliation factor. So once again, that super fun word, interfollicular epidermal hyperproliferation, that's where you're going to get it out of our pro line using retinol, not retinoic acid, but utilizing our retinol and our lactic acid. And our pro anti-aging pads work fabulously
Say
for
it
that
again.
exfoliation.
Say
Pro
it again.
anti-aging pads, fabulous.
This is what
Everyone
I
loves
call
the pads.
I call these little discs of amazingness. Like I have people who I'm out of discs because that's what we do the pump up in my shop. Let's get them excited about the products they're using. But those pro anti-aging pads have make a huge difference, not just for exfoliation but also for inflammation.
Well, the once again, that pro anti-aging pad actually does have the topical probiotics and the advanced healing peptide delivery system in it. So that's where it makes those pads so unique, because you can deliver those active agents into the skin, no irritation, no redness, and it just gives them that amazing result. We also sometimes you can see clients that have an aversion to benzoyl peroxide. And if they do need to be utilizing alternative active agents, the Pro C4 retinol serum, the Pro retinol cream, and like we just talked about, the little discs of amazingness, our Pro anti-aging pads, all are wonderful alternatives. And they can also, once again, because of that retinol factor, can target aging too. So sometimes I've found that just flip-flopping sometimes when you want to seasonally change your products, flipping back and forth from the Pro and the Ice can be effective that way as well. So you can see here some before and afters that we're using Lira Clinical products as well as Lira Clinical in-clinic treatments. With this, there are a couple of kind of in the box, as you want to say. I never like to put acne in the box, but some of those products that can work for that. With that, when we're dealing with that adolescent acne, that prepubescent acne, they are struggling with a lot of that oil. That's where your salicylic acid can come into play. Now, using the ice refining mask is a wonderful product that your adolescents can use. They can use it as an actual mask. They can use it as a spot treatment overnight, or I've even had clients that will apply a very thin layer and sleep in it overnight because of their oil production.
Oof.
Now, how can we do that? What allows that to be able to have that ability is, once again, that healing peptide delivery system that is throughout the ice line. We also have more inflammatory acne, that acne vulgaris. When we are dealing with that inflammation, a lot of the times that client needs that follicle clean out, that follicular clean out. Benzoyl peroxide works very, very nicely, but because once again, we're taking that benzoyl peroxide in other products might be irritating to the skin, because it has that healing peptide delivery system, and we've also incorporated nourishing plant stem cells. That's where, for example, our ice clarifying treatment is not going to be as irritating on the skin. We've also had those topical probiotics, so it's not going to strip that barrier so much that the skin is vulnerable. And finally, we have, if you are struggling with that adult acne, maybe the client was on birth control throughout their teens, their 20s, and now they're in that perimenopausal state, and all of a sudden this acne has popped up. Our Pro Retinol Cream is a wonderful cream that can address both acne as well as aging and pigmentation with that combination of our lactic acid, retinol, resorcinol, and hexylresorcinol.
Tiffany, I just want to jump in and say that this category, adult acne, is
So
where
broad.
where I find a lot of idiopathic
Yes.
Idiopathic acne in this one. And I have to tell you from firsthand experience, it's so frustrating. I had beautiful skin, teenage years. I was improperly diagnosed with PCOS in my 20s. And then I really didn't start having this. I'm 43 now. And that is when, I guess probably about 5 years ago, is when I started really finding my quote unquote hormonal acne changes. But it's frustrating as a sufferer. It's like, where is this coming from? I'm trying to not eat this. I don't eat soy. I drink enough water. I have all these things, but that pro retinol cream and combined, I would alternate that. This is how I got out of it, I guess is what I'm getting at. How I got out of that hole is with this kind of exfoliation. And it's such a beautiful product, I think. But alternating with something else that felt completely counterintuitive, which was the Mystique Illuminating Beauty Oil. So that almost revived my skin and restored it to function. But it made me very empathetic to my client. I mean, I've had it here and there my whole adult life, but not like this. Like this is miserable. And so I just wanted to jump in and say, as a practitioner and a patient, that pro retinol cream is beautiful, and especially when you alternate with some Mystique Illuminating Beauty Oil.
Yeah, it's a great combination that can be used. So Lira's acne solution, you can see here once again a before and after with that inflammatory acne that is clearing up beautifully. But truly, that acne solution is going to be that balancing act of exfoliation and hydration. And how we get that is through that advanced healing peptide delivery system that only Lira Clinical offers, because we can deliver those active agents into the skin that help to clear out that follicular debris while maintaining that healthy barrier activity. So we have those active agents that can get in there, get everything out of that follicle, clear it up. It's kind of like the SWAT team for your follicle. It's going to say, hey, we're breaking up this party. It's done. And everybody's going home. And that's where we have the ability to do that with our Lira Clinical products. So we're so excited that we now can offer not only digital classes, dun, 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 but also in person.
Finally.
Yes. Our acne clinic classes are now available depending upon your area. We have both digital and in-person classes available. So if you contact your Lira Clinical Territory representative, say, hey, when's the next acne clinic class? It goes a lot more in depth, talking about specific clinical studies, also with client consultation, as well as a variety of in-clinic treatment opportunities and that home maintenance that can collaborate with all of those things together. And we do now have our online fundamental certification that is available online as well through our Lira Clinical website.
Which is amazing. It's chock full of information that will build on your school experience, of course. It then also builds on your practical experience, no matter how many years you've been a professional, wherever you're starting in, whether it's at the beginning, fresh out of school, or you've been doing this for years. It is a powerful certification course.
Absolutely. We've taken skin science, the fundamentals of skin theory, and we've combined it so also incorporated with some Lira clinical product knowledge as well.
So thank you for tuning in to Acne Awareness. On behalf of Tiffany, myself, and the entire Lira Clinical team, we want to thank you. If you have questions, please reach out to your rep directly or call the customer service at 877-440-5472 or by emailing info@liraclinical.com. Thank you.
Thank you. Have a wonderful day.